The Inland Empire Health Plan and Healthy Heart Nation have partnered for this series to discuss the importance of heart health in the African American community. Leading this conversation is Kenita Bourne, a licensed clinical social worker and the manager of social and community services at IEHP, and Dr. Columbus Batiste, a board-certified interventional cardiologist. Let's join this conversation where we will dive deep into crucial topics and provide you actionable tips to help you and your loved ones live heart-healthy lives.
Okay, Doc, so we talked about a lot of things just now. We talked about what is blood pressure, how do we check. One thing that I think is really important to know is what is a normal blood pressure range and when should we start being worried? So that's what I want us to talk about right now. What's normal blood pressure in numbers?
Well, let me ask you back first, right?
Okay.
Because this is something I get a lot from patients. What do you think normal is?
Well, I'm a therapist, so normal doesn't exist in my world. Now that we've put that out there, so I feel like with the low number, which we said is diastolic, okay, I'm learning.
Yes.
Anything under 90 for that number, it's normal.
Okay.
That you're not making me feel confident.
Well, I was letting you finish your answer.
You're letting me finish. Okay,
Yes.
cool. And for the high number, the systolic, anything under 130
Okay.
is normal.
Okay.
Did I pass my test?
Well, you passed it in some ways.
Okay.
But let me kind of give you. So first, what I'll tell you is that I loved your answer about the original true normal. And so normal from the large sense is what we look at averages. But when we look at, so we're comparing those averages to the lowest burden of disease. And so we want those numbers to be as low as possible to decrease your burden of disease. And so when we look at studies as a whole, we know less than 120 over less than 80. That means systolic less than 20 over the diastolic less than 80 is the ideal. Now we say something between 120 to 130, you're kind of starting to get into that pre-hypertensive phase.
Got it. So my normal was pretty much pre-hypertensive.
Yeah, your normal wasn't so normal, right? Your
Got
normal
it.
wasn't so ideal.
So I gotta worry
But that's
about some
okay.
things.
Yeah,
Okay.
so we may have to check that out a little bit in a second or two. But, and then as you move up and you move into above 130s, and specifically when you get above 140, we know you're in stage 1, and it begins to progress through stage 1, stage 2, hypertension, right?
Okay.
And so what that means, just like going back to the analogy I gave previously, which is the higher that pressure, as I begin to water, depends on what's going on, my risk burden that's there. If I'm using a garden hose where the pressure is turned up, that may be too much for a rose bush, but may be okay for the lawn. If I move over to the fireman's hose, that's even more detrimental to the lawn and the rose bush. And so those numbers, as they continue to incrementally go up, become problematic. If I add to that, now I'm a diabetic, the numbers are it becomes more concerning at lower numbers in terms of what my blood pressure is. When I'm in over 130, over 90, and I'm a diabetic, that's even more concerning. If I'm in the general population, over 140, over 90, that's more concerning. So those numbers vary. So ultimately what I tell patients, not to be comfortable with the high numbers and worry about the stages as much, but try and focus on getting those numbers down as low as possible. And so that means you have to not only be aware, you have to not only be on treatment, but you have to use the treatment to get you the target.
Nice.
The other way I put it is that it's not okay for us to go ahead if I'm baking a cake, right? And I have my eggs and I have my milk and I have my flour and my sugar, and the recipe calls for a certain amount of each of them. I only use a fraction. I'm not going to get the desired outcome. So I have to target health from a holistic approach, hitting on the medications at the appropriate dose that's going to work for me as an individual. Not for my cousin, not for my barber, not for my sister, but for me.
Got it.
Each of us are different.
I love that you said all that. And I don't want to go too off topic,
Yeah.
but I've always heard, because you brought in if you have another condition like diabetes.
Yes.
And I've always heard that diabetes and hypertension are like kissing cousins. If you have one, there's a high likelihood that you're going to have the other.
Yeah.
So if you have one, You got to really pay attention to how you're taking care of the other, is what I'm hearing you say?
That's right. So they run in a pack. High blood pressure, high cholesterol, diabetes all run in a pack. And so diabetes oftentimes is a vascular disease. So it lends itself towards developing heart disease, which high blood pressure is a form of heart disease. And so the way I think about diabetes is think of it like if you ever spill a sugary substance on the floor and it gets real sticky. Well, that's what's happening inside your vessels. It's becoming sticky, so to speak. And so it causes disruption of the vasculature that can lead to elevated blood pressure, cardiovascular events like stroke and high blood pressure and kidney dysfunction.
Got it. Thank you. Thank you for that. And you talked a little bit about stage 1, stage 2. Did you say stage 3 also, high blood pressure?
It's usually stage 1, stage 2. It's a new formulation. And then we're looking at hypertensive crises.
Got it. Is there anything else that we need to know about stage 1, stage 2? And hypertensive crisis sounds terrible to me.
Well, yeah, it just means that your numbers are so high because most instances, I'm gonna end with this. Most instances, most people don't have symptoms with high blood pressure, what studies tell us. Even though most people say they have symptoms with it, they don't. But if you do have symptoms while your blood pressure is over 180, over 120, that's very worrisome about impending stroke or heart attack. And that's what we call a crisis is brewing.
Got it.
Yeah.
So
Stay away from the crises.
stay away from the crisis. I can get behind that.
Know your numbers, take your meds.
Your meds, not your cousins.
That's right.
Nice. Thanks, Doc.
All right.